Welcome back, everybody, to a Little Less Fear podcast. Today, I'm super duper excited to introduce Dr. Bisleen. She's a naturopathic doctor of mental health. And today, we're going to be talking about the vagus nerve, not like Las Vegas. And the reason I have to say that is because I told my mom this morning that I was going to be talking to a doctor about the vagus nerve. And she said, I love Vegas. And I was like, no, mom, it's spelled differently, but it sounds the same. So welcome to my show, Dr. Bisleen, and thank you so much for your time and all of your education and information. I really appreciate it.
Yeah, thank you so much for having me. I'm really excited to talk about this topic because, again, as we were mentioning before, it's everyone talks about it. They think they know about it, but then they really don't.
What got you interested specifically in the vagus nerve? And could you explain first? Let's go because I've got a wide range of listeners, so let's explain what the vagus nerve is first and why you got interested in it, and then we can talk about however whatever order we want. Let's just talk all about it.
Yeah, I love that. I like starting off with just, what it is, where it works in our bodies, because a lot of us don't know that. So in our bodies, we have 12 cranial nerves. Okay. These are nerves that extend from our brains and they go to different areas of our body. The vagus nerve happens to be the longest cranial nerve in our body. And it's actually the 10th one. And so it literally extends from, all the way from our brainstem, all the way down to the abdomen. And sometimes people even call it like the wandering nerve because it's so long. And because it just extends from the top of our brain to all the way to our abdomen, it intersects and it helps to really provide support to some structures along the way, right? So for example, it goes through our neck. So it's responsible for our swallowing. It's responsible for supporting our voice. It goes through our thorax region, which is where your heart and lungs are. So it helps to supply, stimulation to the heart and can help control your heart rate and breathing rate. And then it goes all the way down to the abdomen. And there it can kind of control your intestinal muscles. It can also control like how much, fluid your intestines are secreting so you can appropriately digest. So so those are like all the systems it kind of interacts. And so it impacts everything from digestion, heart rate, respiratory rate, to even like your coughing, sneezing, vomiting, swallowing. So it has a really big function in our body.
Yeah, it sounds pretty impactful. I mean, with every single thing, I'm assuming that it also helps with digestion, metabolism. Does it also help with all that?
All of that, because it directly communicates with our digestive system. So it has an impact on all of that. And really why I got interested in it, it's just the research just started to come out with this. And there's a big link between the vagus nerve and breathing. That's what really got my interest in it. But we can talk a little bit more about that when I explain like strategies and really explain that connection there. But tons of research is coming out now on the vagus nerve and people trying to develop strategies around that. We can talk a bit more about like vagus nerve stimulation and all the research on that.
I'm wondering right now, as you're explaining, like why it's taking a while for doctors to really hone in on the vagus nerve. It almost seems like they've skipped over. Let's talk about the phrenic nerve, or let's talk about this, and all of a sudden it's like vagus nerve, and it's on all these other podcasts. I mean, why did it take a while for people to actually get a hold of this?
Yeah, I wish I had the answer for that, but I don't. It's just the way how research, I guess, works. I think a lot of when it comes to research, we start off by focusing on things that we like discover first. True. And, that takes a really big focus and it just depends on what people are able to discover. Other times, when people get conditions that come off as like, we don't really know what's happening here. And it forces like the medical community to go further and then more research is like developed on that. So many reasons as to why, but like now we're in a place where there's tons of research out on it. So we should be talking more and more about it.
We should. And actually I read a study once where somebody was getting their ear pierced. I guess it was close to the vagus nerve and they died because it stopped them from breathing. And it's like, what in the world? I remember when I read that, I was like, are you kidding me? Why aren't people talking about this? It's like people are just piercing everything and everywhere and not even realizing what nerves are in the way. And wow, that's pretty crazy.
Yeah. That's actually like, I had never heard about that. That's actually insane. But what's so interesting though, when we'll talk more about this is there's therapies used to stimulate the vagus nerve. And there's one you can do where you actually implant something inside your body. And then there's one that you do outside. So it's not invasive. And you know where that goes? It in your ear. So that actually makes so much sense because therapeutically, to stimulate the vagus nerve, you actually attach stimulators to your ears. So
Yeah, don't pierce it. Put a stimulator on there instead.
But I mean, the research has shown it actually works really well to stimulate it, and people actually have some really, really good results with it. Yeah. Yeah.
So tell us how how this became an interest of you with mental health, and how are they related?
Yeah. So really the biggest interest for me, so two reasons as to why. Number one is the whole deep breathing piece of things. So, I honestly feel like now meditation is like a buzzword. Um, and really what I've noticed with a lot of us is that even though people say they're meditating deep breathing, no one's actually doing it right. And how you actually want to breathe deeply is you want to be using these diaphragmatic breaths. And so what that means is that, and I always, whenever I lead my patients through this exercise, I always tell people, right, take your left hand, put it on your chest, take your right hand, put it on your belly. Okay. And we can even do this right now. And what you want to do is, when you're taking a deep breath in through your nose, out through your mouth, what you want to make sure is the hand on your belly is moving up when you breathe in, and then out when you breathe back in and move back in. And when you do it like that, that's how you're taking those deep belly breaths. But a lot of us, we're just breathing from our chest. And so we're not getting that full vagus nerve stimulation. What happens when you breathe from your belly is that you have your lungs enclosed up here. And then your lungs are essentially enclosed in something called the diaphragm, which kind of sits underneath your lungs and it closes your lungs. When you take those deep belly breaths, your lungs move down, diaphragm pushes down, which stimulates that vagus nerve. And that vagus nerve runs all the way from your diaphragm / your abdomen to your brain. And it tells your brain, hey, you relax, calm down, right? And so that's why, that breathing meditation piece can be so powerful. And so when I first started to get into really working on my mental health, breathing was one of the things I first turned to. Not by choice, actually. My parents forced me to do that a long time ago. And, everyone, whenever you talk about breathe deeply, and I was like, oh, no, it's so simple. Like it sounds so stupid, that it can't work, but it's powerful and it does work. And so when I started to really look at it,
I want to point out something about what you said with the breathing, how important it is. It's so important. Like I've noticed some of my friends when I'm even hanging out with them, and they're talking and they're even taking a deep breath, and I notice that they're breathing from the chest, where they'll be like, and then they'll keep talking, and I'm a little more keen observed to that, and so bad, but I'm not a professional in this. I can't tell them, slow down, take a real breath, but I can tell when it's coming from here versus it's coming from here, and that's really impactful, because once I started practicing that myself, I'm able to relax myself. But yeah, go on.
No, you're so right. And that's the thing, right? Our body literally has a system to help us relax in any moment. And we don't realize that. We're so quick to turn to things outside of us to support us, but it's like, hey, you can support yourself. And the best way to do that is to activate the breath. So when I started to really get into meditation, I was so curious about that underlying physiological cause and why it works so powerfully. And that's when I really got into the vagus nerve. And I was like, wow, this is fascinating. Right. And the second reason as to why I choose, so one is that deep breathing piece of things. And the next piece is the gut brain axis. So tons of research is coming out now to show that our gut directly communicates to our brain, and that our gut literally has its own nervous system called the enteric nervous system. It releases 30 different neurotransmitters. Our gut is lined with, I think, something like 300 billion or million neurons, more than our brain.
Yeah.
And 95% of our serotonin is actually released in our gut, not even our brain.
Yes.
And so what is that direct communication between the gut and brain? The vagus nerve. And so that has also got me so fascinated as to how, whenever you consume foods, the rate that you chew, all that stuff, are you in a high stress environment when you eat or not? All of that stuff, your vagus nerve, your gut microbes are picking up and signaling to your brain and telling your brain how to feel as a result of that.
That's so amazing. We learn in Buddhism that you should take your time to eat and relax and take some deep breaths and really enjoy it and feel the blessings of your meal, but it goes even deeper than that physiologically. And I do notice, I hate to put spotlight on my guy buddies, but a lot of the times they're just like air breathing the burgers and stuff, and
Oh,
I'm like, whoa, just hey, how about
oh
take a
yeah.
couple bites and enjoy it and let your body digest it. And but yeah, but it's because we're living in this society, this environment of go 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 go, and people stay in that go 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 mode up until it's time to relax, and then when it's time to relax, they don't know how to relax and how to shut things down.
Exactly. Exactly. And yeah, and that just has such a profound impact on not just your mental health, like everything else. And I think also too, right? Like we can't make the connection. Like we're just not taught this, right? We're not taught that when you eat your food really, really fast, that's going to give you poor digestion. And that poor digestion is going to directly tell your brain and make you feel not so great. Versus if you took that same piece of food, ate it in a calm environment, relaxed, chewed, you're going to have a totally different impact on your mental health and brain health as a result of it. We're just not taught these connections. We think that our brain is just a separate organ and our brain just tells everything what to do, but no one's ever told that, hey, no, your brain actually listens to your gut. There's that bi-directional communication. They both work hand in hand. Your brain's not just telling every organ in your body what to do. Your brain
Yeah,
is getting feedback from your organs as to how to function as well.
and that's why we have that quote unquote gut instinct.
Exactly. Exactly. And that's why you have mental health concerns, people with anxiety, and I treat them. Yes, I'm helping them with their mental health, but we're also looking at their gut. People with anxiety sometimes feel nauseous, their stomach feels tight, right? And looking at all that. So yeah, very important to address that communication and connection.
How do you address that?
What do you mean? Like in terms of like
Let's say
how
somebody
can
comes
we
in and
work
they're
on it
and
to make it
they
better?
somebody that's highly anxious. How do you start to address that and incorporate vagus nerve relaxation techniques with them?
Yeah, great question. So anxiety, I mean, as a state, the way that I think about it, the most general way, just like it's a very heightened state of emotions, right? A heightened state of usually negative emotions that don't make you feel so great. And so ultimately the goal is to kind of get that heightened state to be just a bit more at that normal level, or just at a place where you feel like you have more control over your emotions and thoughts and can actually be how you want to be. And so when it comes to that vagus nerve piece of things is number one is just trying to get their body to be at more of like a calm state, right? And
Hmm.
not just jump into this overdrive of heightened emotions. And so that's where just doing simple exercises like the deep diaphragmatic breathing, taking those belly breaths can make such a big difference. That's something I do with my patients. First visit, I teach them all this. I'm like, this is going to be your new way of breathing and being. Okay. And
Yeah,
getting them to practice that as much as possible. you know Other things, and this is what the research has really shown too, is just also just connecting with the here and now and just being present. A lot of research has been done on like mindfulness based interventions. So mindfulness is just a fancy word to say being present.
hmm,
Right. So mindfulness based interventions are basically present based interventions. And they've shown that the more that you connect with the here and the now, the more relaxed you tend to be, and the more that your vagus nerve tone gets better and gets stronger, and you end up being in that relaxed state. So ultimately, anything that helps you get relaxed puts you in positive mood. That's another big one too. When you're in that positive mood, they've shown that the vagus nerve tone gets stronger. So doing things like literally laughter, humor,
joy.
humming, singing, joy, all those things, getting connected with nature, because that brings you into the here and now. Right? Doing things that slow you down. Like, I don't know if you've ever heard of yin yoga before.
I have, but I'm certain there are some listeners that may not be aware of what that is.
Yeah. So yin yoga is a form of yoga where you hold a pose for anywhere from a minute to 5 minutes. Right. So again, just really slowing down, connecting with your body, being in the here and now. And then another interesting one, though, which is a little bit different than the ones I'm saying, is cold exposure therapy as well. Helps to stimulate and strengthen your vagus nerve tone. Because what starts happening is that when you expose yourself to cold at first, your sympathetic system is activated. So that is your stress system, because like your body's in like a shock, like, oh my God,
Hmm.
what's this cold? Then what happens though is if you force yourself to kind of just be there, your body accumulates, it adapts. And so what ends up happening is that your sympathetic state transitions to your parasympathetic state, which is your resting state. And so cold exposure therapy can actually improve your vagus nerve tone through that.
I would say too that would be kind of something to tiptoe around with people that've got autoimmune diseases Like for me, for example, I have a defect in the NLRP3 genetic variant, and it causes
Yeah.
familial cold urticaria syndrome. So I personally couldn't be in any type of cold, icy
Yes.
environment.
Yes.
So I would say ask
Yes.
your medical doctor first before doing anything like that. But I can definitely understand
Yes.
physiologically how that can do
Yes.
a reset on your body and kind of get you to more of an equilibrium type state.
Totally. And that's actually a good point you're bringing up just with any of the suggestions. I know some of them sound simple, but always, consult with your doctor,
Yeah.
like a professional you're actually working with to make sure these work with you and don't just like take these and start using these. So yes.
Do you get patients that let's talk about the vagal tone a little bit. And when you're working with vagal tone, do you get patients that come in with depression or anxiety that are on these SSRIs or SNRI medications or benzos and they want to get off it, or they're contemplating getting on these medications and they want to try working with their vagal tone first?
Yeah, I would say it's probably the first one more. Usually I get people who have either they've tried medications, hasn't worked for them, or, they're a little bit hesitant to try medications and they want to try more of like the holistic natural route first. And then they want to do that. And then, yeah, I do have patients here and there who want to get off their antidepressant medications, but that's a pretty lengthy conversation, and it's a lot different than how I treat those patients because they're on a very strict protocol. We're
Right.
slowly weaning themselves off, so it's very different with them compared to people coming in. But with those patients coming in with anxiety, depression, almost all of them were doing some sort of vagus nerve stuff, because essentially it's all about just getting calm, getting in the here and now, slowing down, and just like really connecting and being with your body.
I love it.
Yeah.
I love all that
Yeah.
stuff.
Another also, as because we're talking about tips, and again, this one I would recommend talk to a naturopathic doctor, talk to your doctor, but lots of research on probiotics too, right?
Mhm.
Because again, because our vagus nerve is super connected to our gut microbiota.
Mhm.
And based on what our gut microbiome secrete in terms of hormones, neurotransmitters, the vagus nerve will then relay that info to the brain. So probiotics can help to replenish your gut microbiota and make sure you have more of that healthy bacteria. And so it can also improve that vagus nerve connection and just overall that gut brain connection as well.
Yeah, I've realized through my own personal research and my own health journey that probiotics were, to me personally, more of a bandage. So what I started to do is incorporate more whole raw foods
Yes.
and having more sauerkraut and full vegetables, staying away
Yeah.
from lectins
Love
and
that.
things that were actually going to rebuild my gut microbiome more naturally, the way it initially was, evolutionary speaking. And I'm actually, without intake of extra protein or other supplements, I'm seeing my body thrive more than ever before doing these wholesome probiotics, prebiotics, other than popping a pill in my mouth. So, and it's definitely improving my vagal tone. I can feel that for sure.
Yeah. And you do bring up such a great point too. And even the way that I work as a naturopathic doctor is like, supplements and things that's how they should be worked as, right? There should be like supplemental to what your current diet is. And usually when I work with patients, I'll have them be on, high dose supplements for a month or two while we work on rebuilding their healthy habits. And then the point is for them to get off them and only use it, come back to them if they have high stress situations or, they just don't have time in their current life to just take care of their diet. So that's when they use it and how they should be used. So great point.
What about for people that have difficulty sleeping? This is a huge topic amongst people all over the world. I can't sleep. I can't sleep. I don't sleep. And it's like, wow, I hear this all the time. And it's like I run out of advice because it just seems so all over the place. But I'm almost certain that the vagal tone has a lot to do with it. What kind of advice can you give with sleeping and relaxation and having a good night's rest and vagal in your vagus nerve?
Yeah, great question. I get that a lot too. That's like the number one thing.
It's everywhere,
right? Yeah. And it's such a funny concept too, because I'm just like, okay, let's take like animals, right? Like, does a squirrel need anything to fall asleep? No, he can just fall asleep. Right? Right? Or like those cows on the farm or whatever.
Yeah, right.
And just like us, we have it within us to have a good night's sleep. But again, as you mentioned before, the go, go, go lifestyle. Right. And so physiologically, I'll just explain just briefly what happens and why we can't fall asleep. Ultimately, you want your body to be in something called the parasympathetic state that I mentioned before, right? That is your resting and digesting state. What happens with a lot of us, because we lead such a busy lifestyle, our body ends up staying in the sympathetic state, which is our stress state. And as a result of that, we are unable to relax and we are unable to actually get a good night's sleep.
Right.
So the whole point and process should be an hour before bed should be your time to unwind so your body can get into the parasympathetic state and sleep. Now, the connection with your hormones too is that when you're in the parasympathetic state, your body produces more melatonin, which is your sleeping hormone. It basically signals your body to start falling asleep on time. When you're in the sympathetic stress state, your body doesn't produce that as well. Right? Because in the stress state, you want your body to be high alert. You don't want to be sleepy during that time. So your body can, fight or it can flight.
Yeah.
Right? Yeah. So that's the whole process, is just to emphasize, is that we all want to make sure we're getting into that resting state. How the vagus nerve can then come into this point is that it's your direct communicator to your brain to rest. Right. And so doing some of these exercises, like the deep breathing before sleeping, right? And doing like a yin yoga type thing, and just really getting your body to slow down, be in the here and now. It can help you to get a better rest. And really, let me tell you, the biggest reasons we all can't fall asleep is because of technology before bed.
Oh,
right?
Yeah, absolutely. Totally.
And so, right. And so when you're on technology, immediately your body's in the sympathetic state. I don't care if you use blue light, green light glasses, whatever it is.
It's not going to work. No.
It's not going to work. Either way, your body's going to be in a stress state. Technology tells your body to stay awake, right? And so we want to completely counteract that and implement some of these activities to get our bodies to slow down, be in the here and now, so that your body can actually get tired and be like, you know what, I want to fall asleep. So, yeah.
Something I've been incorporating with my breathing before I go to bed that's been helping me, and I hope that this goes out to the whole world. Breath. Controlling my breath by counting 6 seconds. 6 seconds in, hold for 6 seconds, 6 seconds out, until I can feel that I'm breathing at that interval. And when I'm able to do that, I'm able to become more at a relaxed state. And I even do that when I'm exercising. So for example, let's say that I'm doing a bicep curl. I'll 6 seconds up, hold for 6 seconds, 6 seconds down, so that I'm able to, even at a stressful state, control my breathing and just have a little bit more peace of mind and not such an active vagus nerve. Do you find that to be helpful as well?
Yes, like completely. I am just like, I breathe deeply all day long, every day, and especially before bed, like I'm sure we've all had those nights where we're just like, oh, stressed out, stuff going on in our minds, but just immediately connect with the breath. And I love the idea of just like counting, so that you make sure you're doing it slow enough too, because that's a big thing as well. You don't want to be doing these fast breaths, be as slow as possible. And the counting can kind of help that. And again, for the people listening, if you feel like you're having one of those nights where you're just lying in bed and the thoughts won't stop, connect with your breath, connect with it, get your body into that relaxed state, just breathe deeply while you're lying in bed, and you'll notice yourself immediately seeing the impact of it.
Thank you, Dr. Bisleen. I have a question about vagus nerve stimulators. I personally don't know much about them. What can you tell us about vagus nerve stimulators? Who is a candidate for them, and what is in it, the technology in the long haul? I mean, is it even going to last?
So usually vagus nerve stimulation, they're used in mostly epileptic or like neurological conditions.
Okay.
And there's been some research done in like treatment resistant depression as well. So this isn't something like a first line treatment I would go to for people with mental health conditions, but this is more so if you have more of those serious conditions, or like, doctors have looked at you being like, yeah, your vagus nerve tone is definitely damaged, something like that. Then I would go into using these. For, most of the population, doing the simple techniques like the breathing and the other things you mentioned before are enough to stimulate that vagus nerve tone and build it. Okay. But there's essentially been shown to be two different types of ways to stimulate the vagus nerve that you can get done. So you can have like a directly invasive surgery. So this is where they, cut you open. That's what invasive means. They go inside and they'll put like a small pulse generator on the left thoracic region. So near your heart on the left side, they'll put that so that the vagus nerve like pulsates. Okay. And research has been done to show that it has, anti-inflammatory properties, anti-epileptic, antidepressive effects. Because again, vagus nerve tone, it kind of, slows your body down, gets it into that calm state. Okay. Then you have the one that's like the non-invasive procedure. And so with that, what they do, they actually attach a stimulator to your ear via ear clips, and it stimulates the vagus nerve from there. And so, I mean, even with that, again, most of the studies have been done with treatment resistant depression. And it's shown that, it does have a beneficial impact on people suffering with these. So it's just another method to try and work. If you feel like you're someone, you've tried a lot of different things and hasn't worked, having a conversation with your doctor about that.
How does a patient or just anybody know whether or not they have vagus nerve damage?
Yeah, that's honestly a really, really great question. I will be quite honest. That is the one thing I am not fully sure about, like the exact testing that they do. I know that, symptoms can definitely indicate you're having vagus nerve damage.
Mm-hmm.
Like, so if you look at all the places like your vagus nerve innervates, your digestion. So like the swallowing is affected, you're feeling, like you want to vomit and things like that. So that can really indicate so symptoms can definitely point to that. Exact test, I'm sorry, I actually did not look that up. So I'm not sure about that. Mm-hmm. But I will be honest, and I think that in our day and society that we live in, everybody needs to work on their vagus toe. So.
Oh yeah, I mean, I could definitely see if in a reactive state how the vagus nerve could be damaged, but I can also see that if somebody has some type of buildup or amyloidosis or something within the nerves that would cause it to dysfunction, and in that case would be a little bit more challenging to treat.
Yeah. Yeah, then it definitely does get a bit more complicated with that, and really seeing, what's the root at the issue that's impacting your vagus nerve tone. And that's going to completely change up the treatment, the testing and all that.
So I see you're passionate about this topic, as I am too, and I'm wondering what got you passionate about it.
Yeah. So, I mean, a big thing was like my journey with mental health. So, I suffered from 5 years of chronic depression as a youth. And when I was growing up with this, and I come from a South Asian background as well, like this stuff wasn't talked about at all. And I just didn't even know where to turn to. So I started doing a lot of my own research and just like experimenting with everything, because I was like, I am getting over this no matter what happens. And not even God can get in my way. So I started experimenting, doing tons of work. And then, as I mentioned earlier, as I started to do more of the deep breathing, which is what I was like, wow, like I feel so good with this. And like, how is this working in my body? Why is this making me feel so good? And just coming from a science biology-based background, I was always interested in physiology of things. And so I started doing more research and realized, oh, it's the nerve, it's the vagus nerve causing all of this. And then as more research started to come out with the gut-brain axes, and I started to get more into naturopathic medicine, treating my patients and stuff. So that's really where my passion for this comes from.
That's awesome. Thanks so much for sharing your passion.
Yeah.
Is there anything else you want to share about this topic?
No, I think like this was sure quite a bit. I would just, really recommend everyone listening to just, the key point and takeaway here is that it's just about being calm in the here and the now, and just developing those strategies that will just help you feel grounded and good in your body. That's all it is. It's just coming back to the here and now. And the more that we can be in the here and now, the more at peace we really are, because in this moment you're in, everything is okay. Right. And it's when we let our minds go too forward or too back that we start to feel in distress. And so that's what all of this is about. If that's one thing anybody wants to take away listening, it's just be in the here and the now, and use these strategies to help you do that, because that is when you'll truly feel good.
Do your best to not be living in the past, and do your best to not be living in the present, and let's be living now. That's why I feel so calm right now, because I'm in the present with you.
Exactly.
So how can our viewers, our watchers, and our listeners find you?
Yeah, so I have, I'm on a lot of different apps. You can find me on TikTok, Instagram. I have a YouTube channel too, Facebook page. You can find me at Dr. Bisleen Attli. So you can search me up on any one of those platforms. And if anybody has any questions on any of this stuff, I love connecting with people. So reach out to me. I'm more than happy to point you to resources that can help you in your mental health.
And you also have a website, www.mentalempowermentcenter, as in centre.com/support.
Yes. Yep. So if you want to directly contact me, more than welcome to do that. If you really want to work with me too, I offer everyone a free 15-minute assessment. If you either want to work with me or I can point you to, a different practitioner who can benefit you, I'm more than welcome to do that as well.
Thank you so much for your joy, your light, your energy, and your knowledge. I really appreciate you being on the Little Less Fear podcast, and I hope to keep in touch with you. Take care, Dr.
Yeah,
Bisleen.
thank you so much for having me here. This was such a great conversation. Anytime you want me back to talk about mental health, I'm more than happy.
I'm sure I will. Thank you so much for being willing. Have a blessed day now.
Thank you.